Nicole joins us today to help demonstrate some of the wonderful effects she has achieved from quantum neurology. We're going to talk about some of the symptoms that Nicole was experiencing from her diagnosis of multiple sclerosis by her medical neurologist. And these sort of things are the things she was experiencing before quantum neurology therapy. She was experiencing a cold sensation in her arms, kind of a deep cold sensation. She had a burning pain sensation from her torso here all the way down into her feet. And at its worst, it was sometimes like an 8 or 9 sent her to the emergency room at the hospital for relief, try to find relief. She was also experiencing numbness, a lack of sensation in her lower back, especially on the right side. There was a difference from the right side of the lumbar spine to the left side. And then dermatome levels that I will show in a moment. She had varying sensation, lack of sensation in different dermatomes down the body. Now I'm going to demonstrate some of the neurological testing that was done before and the results after. All right, for testing sensation, whether there's numbness, we use a little device called a pinwheel. It's a little wheel and it's got little pricky spikes on it. So we run that across certain dermatomes on the body, which we'll show later, and the patient should feel those little pricks all the way down, going on the outside of the leg and the foot. This is like S1, sacral nerve root 1, lumbar 4, dermatome supply. And then on the inside, it's more L5, lumbar 5, nerve supply. So she had a lack of sensation in these areas, especially on the back, using the pinwheel across her lumbar spine, especially on the right compared to left, a lack of sensation. But not just pinwheel, there was a distinct difference between hot and cold, light touch, deep touch, vibrational sense. These things were off, were lacking. All right, I also want to demonstrate a lack of muscle strength. These are called myotomes. And I always tested sacral nerve root 1 with her foot in this position. So we're going to demonstrate, which is no longer weak now, but for the purpose of this, we're going to demonstrate how it used to be. Ready, resist. See that wobble, how the patient is not able to hold the foot in this position. And then after quantum neurology, and usually immediately after quantum neurology session, immediate strength, hold. That's power right there. And to this day, she has continued to retain this power. And then this is a demonstration of L5, which originally was weak. See, I'm able to push her foot down. But now, after a series of quantum neurology sessions, she's very strong and has continued strong. And then L4, this one was weak. And now very strong, hold. And now we're going to move into a different position and demonstrate a different part of L lumbar 4, pulled down, and it was originally weak. There was give, and after quantum neurology, hold. And also L2, push up like you're kicking a ball, weakness. And then after quantum neurology, hold. Very strong, can put my full weight into it. And then L1, lumbar 1, hold your thigh there, hold. Originally not the power she needed. And then after quantum neurology, hold. Very strong. And this one was also weak. L3, hold. And then after quantum neurology, hold, strong. And other ones that were additionally weak, T1, thoracic 1, the ability to hold the fingers apart. This was weak. Strong after. Her grip strength, cervical 8. It's hard to see this, but originally I could break her grip. Now she's very strong, very strong. The wrist down, cervical 7, was weak. Wrist back, C6, weak. Bicep, pull, pull. C6 was weak. C7, push, weak. And cervical 5, deltoids, on both sides. All of these weaknesses were rehabilitated with quantum neurology. I'm going to demonstrate what is called the Babinski reflex, which Nicole originally had a positive. So we're going to demonstrate what a positive looks like. As I stroke the bottom of her foot, the big toe curls up and the rest of the toes flare out. Now, that was before quantum neurology. After quantum neurology, a series of sessions, I'll demonstrate her reaction now. She's going to give this is how she responds now. And this is a normal action when stroking the bottom of the foot with firm pressure that the toes curl down. And I just want to add another little comment on that, prior to quantum neurology, she couldn't curl her toes down very effectively. So that has improved also. So function, neurological function, muscle function, and overall her whole health has improved through a series of quantum neurology treatments. And that's why we're doing this today, to demonstrate the effectiveness of this type of therapy and what it can do for people even with severe neurological deficits and challenges, how it can bring rehabilitation to these people, bring back function and a quality of life. To accentuate the results of quantum neurology, Nicole was placed on a special diet, a low-stress diet, a very healthy eating with additional food supplementation and some herbal therapy too. And that absolutely brings up her cellular health at the very basic level, which makes quantum neurology much, much more effective, especially for cases like multiple sclerosis, Parkinson's, Lou Gehrig's, any severe neurological deficit. Very, very helpful to change the diet.
Thank you, Dr. Warren.